If you're ever trying to do a diet to perfection, it will be difficult. The good news is that for the most part, you don't have to be 100% compliant, but rather 70–80% compliance is enough to really move the needle, or in this case, move your bowels. Defining constipation would be 3 or less bowel movements per week, or a hard time with movement, sometimes probably better described as incomplete evacuation, or taking a long time to pass a bowel movement. Let's start with the quick relief strategies. There's many of them. These are the few that I think make the most sense. Magnesium. There's different forms. There's citrate, which I favor. There's oxide. Irrespective of the form, again, I would favor citrate or oxide. Magnesium is going to pull water into the bowel and function as a laxative. The way to use magnesium in this application would be titrating or gradually increasing your dose until you notice a bowel movement. So magnesium or even vitamin C, with a gradual incremental increasing of the dose, will have a laxation effect. Starting off with maybe 300 milligrams of magnesium, and then you can double to 6 and double to 9. When you hit that appropriate level, you'll know it. The one downside potentially of magnesium is that you can overshoot the landing and go from constipated to looser bowels, but at least this is something that gets you moving. Senna and aloe are also other options that can be used to help with regularity. And with senna, the dosages are 15 to 30 milligrams once to twice per day. And with aloe, anywhere from 500 to 200 milligrams per day. Now, with senna, some have claimed that you should not use this long term. I don't know that I would agree with that based upon Leonard Weinstock's podcast interview, now going back maybe 5 years, as a gastroenterologist who was looking via colonoscopy at the lining of colons of some of his patients who are on senna long term. He did confirm that you'll get some of this melanocytosis or darkening of the colonic wall, but he didn't feel that posed any risk. So I would say with senna, longer term, if it's being used as part of a comprehensive approach, and even with all the other causative supports, you're still noticing you need some senna, I would side with Weinstock on this in that it's probably okay longer term. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health, so it is quite deeply appreciated. There was a very interesting meta-analysis just this year, 2024, from King's College. They looked at just under 800 people, and they had them do one of two things: drink more regular water, 32% response rate or noticeable improvement in constipation. So don't forget the importance of water, because sometimes with your normal diet and the fiber therein, if there's not enough water, that fiber that will soak up water can become like a dry sponge stuck in your colon. And this is why adequate hydration helps to moisturize that sponge and allow it to keep moving. So don't forget how important just this simple water consumption is for regularity. Now, the other group, what did they do? They drank 15 to 30 ounces per day of mineral water, and they had a 46% response rate in their constipation. So 32 versus 46. So if you wanted to go a step further with your water consumption, try mineral water, again, 15 to 30 ounces per day. If a higher fiber intake flares you, it could be that you're not drinking enough water, and that's the first place you want to go. However, it could also mean that you have this other causative factor of bacterial overgrowth, because fiber feeds bacteria, and some people have too much bacteria or imbalanced bacteria, and feeding that bacteria can worsen their symptoms, including their constipation. But nevertheless, adequate dietary fiber intake is going to be helpful for a fair subset of people. So increasing dietary fiber is one thing to at least trial. And here is a list of foods in ascending or increasing fiber content. Whole grains, quinoa and barley, have 5 grams of fiber per cup. Vegetables like broccoli, Brussels sprouts have 5 grams per cup. Also, fruits like avocados and raspberries have 10 grams of fiber per 1 cup. Flax seeds and chia seeds have 10 grams per 1 ounce. And legumes like lentils and black beans have 15 grams per 1 cup. And you're aiming for 25 to 30 grams of dietary fiber per day. There's also supplemental fiber. For some people, especially if you have food sensitivities and you're saying, well, I'm somewhat restricted and I'm still working out what I can eat, what flares me and what doesn't flare me, then you may want to consolidate to a supplement so that you have a little bit more control over the dose and the delivery vehicle. This is where there is pretty compelling data, namely a 2022 meta-analysis on psyllium, where the consumption of psyllium increased bowel movements by 3 additional bowel movements per week. So let's say at baseline, you're someone who's moving your bowels 3 times per week at baseline, then you could go from 3 to 6, so pretty much every day. That's a pretty nice outcome. Psyllium or modified citrus pectin, these two are the most effective fibers for constipation. And somewhat routinely at the clinic, we'll have people trial pairing psyllium along with modified citrus pectin. In fact, this is something that I do daily, not that I'm constipated, but just to help with binding of toxins, with sort of keeping things moving. So something there to think about regarding dietary or supplemental fiber. If you're drinking enough water and you're still noticing that fiber, I have a bunch of salads, I have broccoli, I eat more fruits and vegetables, generally speaking, and I feel more bloated, more backed up. It could be that you're fueling a existing bacterial overgrowth. And this is where the low FODMAP diet has a ton of merit. Sometimes dietary changes are looked at as difficult. And I think this largely depends on the framing you bring to the conversation. If you're ever trying to do a diet to perfection, it will be difficult. The good news is that for the most part, you don't have to be 100% compliant, but rather 70-80% compliance is enough to really move the needle, or in this case, move your bowels. So you may just want to do a quick audit of the fruits and vegetables you consume, moving away, so not exclusive elimination, but just moving away from high FODMAP toward lower FODMAP. And here's a quick juxtaposition. High FODMAP would be, in terms of fruits, apples, grapes, and watermelons. You want to swap those out for things like blueberries, strawberries, cantaloupe, and oranges. With vegetables, high FODMAP would include asparagus, broccoli, cauliflower, garlic, and onions. Swap those out and replace with kale, spinach, and carrots. And then finally, regarding grains, avoid whole wheat bread, barley, and rye. These are all high in FODMAPs, and replace those with oats, quinoa, or brown rice. This would include rice breads. 2 follow-ups on this. 1, we have a food list if you wanted to get the deeper dive on what to eat and what to avoid. The University of Monash has an app if you want even more guidance. But secondly, regarding wheat, rye, and barley, I strongly suspect that there is probably a majority subset of people who have cut out wheat, rye, and barley and improved symptomatically, thinking it's because of the gluten, but it's actually because they've reduced their FODMAPs. The reason why this matters so much is because it's been fairly clearly and robustly demonstrated that FODMAP intolerance improves over time. So if you've cut out gluten and you felt better, don't automatically assume it's due to the inflammatory or allergenic component of the gliadin proteins. It might be the high level of prebiotics or FODMAPs in the gluten that you cut out that is responsible for the improvements that you're seeing. Thus, you might be able to reintroduce successfully. There are also numerous clinical trials that have found various types, or as we call them, categories of probiotics improve constipation, even going so far as meta-analysis level data showing that probiotics improve constipation. Thus, we come to the evidence-based meta protocol we've been developing for years now, You have 3 types of probiotics, blends of lactobacillus and bifidobacterium. Your dose there, 1 to 50 billion CFU per day. Or you have a fungus, Saccharomyces boulardii or Saccharomyces cerevisiae, dosed at 10 to 15 billion or 4 to 8 billion CFU per day, respectively. And then finally, the soil-based probiotics, these are bacillus species, generally speaking, 2 to 6 billion per day. Also, they added in some of these studies, along with the probiotic, they added a prebiotic. This is known as a synbiotic. So a probiotic is just the bacteria. A prebiotic is just the substrate that feeds the bacteria, think inulin or FOS. And then a synbiotic is a formula that gives you probiotic plus prebiotic. That's relevant because they found that either probiotics or separately to that, the synbiotic treatments, both of these were better than placebo in treating constipation. The synbiotics were more effective for constipation than just a probiotic. Meaning, a probiotic combined with a prebiotic is more effective for constipation. If constipation is your primary symptom, because some people will go to diarrhea and oscillate back to constipation, different than that would be someone whose predominant symptom is constipation. You might want to consider adding a prebiotic along with your probiotic. Because in some people, prebiotics can trigger bloating, pain, gas. So quell symptoms a bit first with a probiotic, using a probiotic in isolation for 1 or 2 months, then layer on top of that the prebiotic. Regarding dose, some studies have found that 5 grams of a prebiotic offers benefit with really a minimal likelihood of triggering flatulence, gas, bloating, and pain. You could go to 10 or even 15 grams per day. I would just take this in a stepwise fashion. First, probiotics, 1 or 2 months, get to a baseline. Then prebiotics, 5 grams per day. If that works wonderfully, great. No need to increase, but you could go up to 10, give that a couple weeks, and even up to 15. With one important caveat here, which is with prebiotics, it's somewhat normal to see some transient bloating and gas. And this is as your body and your microbiome is adjusting to having that higher level of substrate feeding the bacteria. That should resolve within 1 to 2 weeks, but just be wary of that or cognizant of that, because it would be unfortunate if you discontinued that trial too soon because you had some bloating, some gas, and you didn't realize that's somewhat normal and oftentimes transient. If it lasts longer than a week or 2, then you might be part of a cohort of people for whom prebiotics just aren't helpful. The next study I felt of merit was looking at ginger. This was a clinical trial in roughly 50 patients who had gastrointestinal symptoms and also had multiple sclerosis. So we have to be a little bit careful because this is a specific population. But nevertheless, let's look at what they found. Comparing placebo to a 500 milligram ginger capsule that was taken 3 times per day, they found that ginger improved constipation and bloating. The researchers commented as follows, quote, "Ginger supplementation for 12 weeks significantly reduced the frequency and severity of constipation as well as the severity of bloating." So like I was saying a moment ago, the nice thing about these natural agents is they have multifold actions. In this case, ginger improves constipation and improves bloating, and the probiotics improve regularity or motility and may also improve things like pain and discomfort. Regarding ginger, it's anti-inflammatory, but it also contains these compounds known as gingerols, not ginger ale, but gingerols. And these gingerols have been documented to increase serotonin in the gut. And this is one of the mechanisms through which ginger will improve motility. Ginger is also used in pregnant women for nausea. So a lot of benefits associated with ginger. And you can take ginger as a tea, or there are 2 products that I'll share here, wherein usually you'll need 1 or 2 capsules of ginger to hit that 500 milligram. And you can take 1 to 3 times per day. Remember, these studies used 500 milligrams 3 times per day. I wouldn't get overly into, or this one study, because it was a one randomized control trial, I wouldn't get overly into the weeds in terms of, do you have to be uber specific in your dose? If you can take the 500 milligrams 3 times per day, great. If you can have a cup of ginger tea 1, 2, or 3 times per day, great. And this will move you in the direction of healing your gut, reducing symptoms, and improving regularity. If you do have bacterial overgrowth, you've probably heard of antimicrobials. And coming back to rifaximin, the antibiotic, there was a really seminal paper comparing rifaximin, the antibiotic for SIBO, against herbal antimicrobials. And I'll just quote, "Herbal therapies are at least as effective as rifaximin for resolution of SIBO." You can use either tool, just wanting to make the point that while the research here may be a bit more nascent compared to drug and pharmaceutical funded research, there is still exciting preliminary data. You're often going to see oregano oil, peppermint, black walnut, olive leaf, and or berberine. And I'll also share the data from our clinic. This is going back plus 5 years, and we finally analyzed this data, and it's currently in peer review for publication. So hopefully it'll be published Q3 of 2024. But essentially, we used 2 different approaches of herbal SIBO treatment, and we documented about a 40% resolution rate of SIBO breath testing with either approach. So the good news there is, whether you're using something more fancy, herbals plus biofilm degrading agents, or just herbals alone, you're looking at about a 40% response rate, which is fairly consistent with the other data on rifaximin, about a 50% resolution rate, or probiotics, about a 50% resolution rate. So looking at multiple data points, you're seeing, roughly speaking, about 50-ish% resolution rate of SIBO, or bacterial overgrowth, with these various tools. Great news, and a thank you to friend and colleague, Dr. Alana Gurovich, who's also been on the podcast in the past. She has tested this and verified she's seeing efficacy. And so this is something that we're starting to experiment with in the clinic ourselves. The protocol goes as follows. You start with half a teaspoon of MSM, and you gradually increase up to 2 tablespoons per day, which would be 30 grams. You stop after 2 months, and if your symptoms return, you can go back onto a half a teaspoon. So new protocol, something to consider. An elemental diet is a meal replacement that is liquid, and it is very, very almost no fiber or prebiotics. What this does is it starves overgrowths. So if you do have a bacterial overgrowth, one of the ways that you can help remedy that is by this liquid medical food, if you will. We can use it as a reset. 1 to 4 days in duration seems to be enough to quell symptoms and get most people moving. So you do it generally, mostly exclusively 1 to 4 days. And then from there, you can replace 1 or 2 meals per day. What's my evidence for that? A drove of clinical trials in inflammatory bowel disease showing reduced inflammation and reduced disease activity when using the elemental diet to replace roughly half of one's calories per day. Walking has been shown to clinically and meaningfully improve constipation. A 2019 meta-analysis summarizing 5 clinical trials compared either usual care, which may include laxatives but not limited to, the sort of recommendations you would get from your gastroenterologist regarding constipation, compared to walking for 20 to 30 minutes per day. And they found there was a significant improvement in constipation when people simply went for a 20 to 30 minute walk. And quoting the researchers here, more time spent on physical activity was associated with more rapid gut transit time. So remember that if you move, your food moves also. What if you're already walking for 20 to 30 minutes per day? Fair. A additional study in this instance, a 2023 meta-analysis, looked at abdominal massage, simply rubbing one's abdomen, and they found abdominal massage was equal or better to usual care, which includes but is not limited to lifestyle recommendations and laxatives. The laxative piece is one that I wanted to expand upon briefly. I've heard two things from people when they come to work with us after they've seen perhaps their conventional gastroenterologist. One is, let's say, something like Linzess, a pharmaceutical laxative. It can work, but there can be side effects. Those side effects may be abdominal discomfort, or you trade constipation for bowel urgency. And I have no, overt opposition to Linzess, but people complain about this as the one, and then on the other, people will remark, and I think very intuitively, very astutely, that I don't feel like the laxative medication is really solving the problem. I still don't feel fully well. Why it is that abdominal massage may be helpful? Perhaps twofold reasons, not an exhaustive list, but there are differences anatomically in the shape of the hose that is one's intestinal tract. And in some cases, the pipework, if you will, can be what's sometimes known as tortuous. The intestines have these sharp turns, tortuous sort of anatomy to them. You can have inflection points where stool or food gets backed up and slows down. It's almost like a traffic jam on a highway, or if there was a windy road, people slow down going around the turn. And simply having some motion can help massage stool through that impasse, so to speak. Two, the other one is if you've had either abdominal physical trauma or inflammation, you can form scar tissue that can press on the tubing and lead to that same sort of inflection point or slowdown point, for which the massage can help to sort of unstick or unstuck the food as it's moving through the intestinal lumen. It's a really simple way, an effective way to improve regularity. And to quote these researchers, abdominal massage therapy shows definitive therapeutic efficacy for functional constipation. So this was a great study giving us another simple, safe, natural technique to improve regularity. And I'll also link to a video that we recommend in our consulting practice. It's not the Bible, so it's just one video to give you a sense of the technique. But in my estimation, we have checked this. There doesn't seem to be one superior technique per se. So this is a good example of where we don't want to let striving for the perfect be the enemy of the good. So a simple protocol of rubbing your belly 10 minutes or maybe even less most days of the week may be sufficient. And when this works, by the way, you're going to see results within a couple of days to a week. So if you're going to try it, just realize you're not waiting for 4 weeks, 8 weeks, or 12 weeks to assess if this is helpful. You'll usually know fairly early on. Pelvic floor therapy for otherwise non-responsive constipation. So think about your care plan following the flow of the studies that we've outlined. Lifestyle and supplemental interventions first. And then this would be if you've done all of those other things and you're still not seeing the regularity that you'd like to have. So in this clinical trial, 40 patients with constipation and who had pelvic floor dysfunction and were also unresponsive to laxatives and lifestyle modifications underwent pelvic floor biofeedback, and they experienced a 50% reduction in the severity of their constipation. What is pelvic floor biofeedback? I always reference Satish Rao, who is a gastroenterologist at U Augusta, who was on the podcast a number of years ago. His analogy was a tube of toothpaste. We want to take the cap off and squeeze the contents, therefore expelling the toothpaste. And in pelvic floor maltiming, if you will, or malcoordination of the muscular contractions, what can end up happening is your anal sphincter stays closed, the cap stays on, and you don't contract to expel the stool. And what the biofeedback therapy does is help people re-engage or correctly engage the musculature. where you contract the abdomen, to create pressure to expel the toothpaste or the stool, and you relax the anal sphincter to allow stool out. Populations that may be at highest risk for pelvic floor dysfunction would be postpartum women and people who have had surgical trauma, like hysterectomies, as one example, but not an exhaustive list. And also people who are training really hard and they're doing a lot of bearing down. All of these things, and also, those who are aging as a natural byproduct of aging, sort of weakness in the pelvic floor musculature. And the pelvic floor is essentially between either the penis, vagina, and the anus, right? It's that literally the floor of your body. And we've had some nice conversations with Jandra Mueller, who is a pelvic floor therapist. I'll put some resources for her and her clinic here, and also another directory if you wanted to look into that. Going back to the conversation on the podcast from a few months back with Dr. Alex Ford at the University of Leeds, he was sharing what I really appreciated, this more contemporary view of irritable bowel syndrome, which can include constipation, being viewed as a gut-brain disorder and not just a gut disorder. So there is clearly an impact between the brain and the gut. And this is why some data, as one example, a 2022 observational study found that 75% of people with constipation reported childhood trauma. Now, this is observational data, so it might be partially susceptible to recall bias and group selection bias, but nevertheless, quoting here, early life events and PTSD, post-traumatic stress disorder, are prevalent in patients with constipation. So there does seem to be something between the gut and the brain, which makes complete sense because the brain regulates functions throughout the body, including the gut. Now, the gut also does have its own localized nervous system called the enteric nervous system, but nevertheless, you want both nervous systems, the one in your brain and the one in your gut, to be working effectively. It's also then probably not surprising that people will report stress flares their gut. For some people, it flares diarrhea. For some people, it flares constipation. But nevertheless, it tells us that some sort of brain-directed therapy can be helpful for these people. This is where time in nature, aiming for 2 hours per week, meditation, or cognitive behavioral therapy have all been shown to be effective either for the symptoms of IBS, and this is where most of the research is, and in some cases for constipation or irregularity. I do hope this helps you get regular, both with quick relief strategies and then causative measures. And if you need help, whenever you need help, please feel free to reach out to the clinic. This is really at the core of what we do. This is why I do what I do and we do what we do, because I've suffered with health challenges myself. And the relief I've obtained from healthcare providers and researchers has literally changed my life. And so if we can help you along your path, we are always here as a resource to help.